There's a potential issue with many of the reported benefits of ashwagandha. While the research highlights numerous advantages, they might not apply to you, particularly based on where you live. To explain this further, let's take a closer look at the human clinical studies and explore what health benefits you can realistically expect from taking ashwagandha. Ashwagandha is widely studied for its ability to manage anxiety and stress. Numerous studies show that taking doses of 300 to 600 milligrams per day can significantly reduce both. When combined with dietary counseling and deep breathing relaxation techniques, its effects on anxiety can be even more pronounced. Additionally, when used alongside selective serotonin reuptake inhibitors or SSRIs, a medication that is commonly prescribed for anxiety, ashwagandha has been shown to further improve anxiety symptoms. It also appears to reduce cortisol levels in stressed individuals, indicating that its benefits extend beyond just psychological effects to include hormonal effects as well. Furthermore, taking ashwagandha daily may help prevent stress-related weight gain when compared to placebo. In fact, clinical practice guidelines from the World Federation of Societies of Biological Psychiatry and the Canadian Network for Mood and Anxiety Treatments even currently recommend ashwagandha root extract as a potential therapy for patients with generalized anxiety disorder. However, not all research has been consistently positive. Some studies show little to no effect from ashwagandha supplementation. For instance, a study involving young adults found that a standardized extract called Ashwagandha did not significantly improve anxiety, stress, or depression scores compared to a placebo. Another study reported that a standardized ashwagandha extract did not reduce perceived stress levels any more than a placebo did. Similarly, research involving college students showed no significant improvement in stress levels with ashwagandha compared to a placebo. So how should we interpret this mixed data? First off, it's important to note that more studies show benefits than those that don't, suggesting that ashwagandha likely works. But here's the catch. Most of the studies that found stronger benefits from ashwagandha were conducted in India or Iran, while many of the studies that showed little to no effect took place in other parts of the world, like the United States and Australia. In fact, many of the US-based studies on ashwagandha find it has minimal benefits on stress compared to a placebo. This suggests that ashwagandha might be more effective in populations from India or Iran than in the US. Why this difference exists is unclear. Maybe the traditional diets in India and Iran enhance ashwagandha's effects in ways a typical Western diet doesn't. Or perhaps the quality of ashwagandha used in India is better than what's used in the US. It's also possible that genetic differences make certain populations more responsive to ashwagandha. Whatever the reason, this difference is something to keep in mind when discussing how effective ashwagandha really is. This difference is a recurring trend in much of ashwagandha's research. Most of the evidence comes from studies conducted in India and the Middle East, where ashwagandha is traditionally used. There's just far less research from other parts of the world. Ashwagandha may offer modest improvements in sleep for those dealing with insomnia. A small meta-analysis of insomnia patients suggests that taking ashwagandha extracts daily for 6 to 12 weeks can modestly enhance overall sleep quality. In elderly populations, ashwagandha may also improve sleep and overall well-being. However, again, most of these studies were conducted in India, not North America. Ashwagandha has also been researched for its potential to enhance athletic performance. For aerobic exercises, a meta-analysis of small clinical trials indicates that taking ashwagandha can boost aerobic capacity in both athletes and non-athletes. When it comes to strength training, another meta-analysis shows that ashwagandha may improve muscle strength, speed, and recovery in athletes and non-athletes alike. Ashwagandha has been weakly studied for its effects on certain psychological disorders. For depression, a small clinical study involving adults found that taking 500 milligrams of ashwagandha root extract daily for 90 days reduced the severity of depressive symptoms and increased serotonin levels compared to a placebo. In the case of bipolar disorder, research shows that taking 250 to 500 milligrams of ashwagandha extract can lead to small improvements in some cognitive measures, though not all, when compared to a placebo. For obsessive-compulsive disorder, or OCD, preliminary research suggests that taking 120 milligrams of ashwagandha root extract alongside SSRI medication may slightly reduce OCD symptom severity compared to taking SSRIs alone. Ashwagandha has been studied for its potential benefits in addressing certain female health concerns. For menopausal symptoms, a small clinical study found that women in perimenopause who took 300 milligrams of ashwagandha root extract twice daily for 8 weeks experienced improvements in symptoms like hot flashes. In terms of intimacy, another study showed that ashwagandha helped improve various aspects of intimacy and satisfaction compared to a placebo. Ashwagandha has also been studied for its potential benefits in addressing some male health concerns. For fertility, preliminary studies suggest that taking ashwagandha for about 3 months can slightly improve sperm count, volume, and motility in men with infertility. In terms of intimacy, a small clinical study found that men who took 300 milligrams of ashwagandha root extract twice daily for 8 weeks reported improvements in various measures of intimacy and satisfaction compared to a placebo. Ashwagandha has also been weakly studied for its potential effects on hypothyroidism. Preliminary research in adults with subclinical hypothyroidism, a condition where hormone levels are a little low but symptoms are not present, found that taking 300 milligrams of ashwagandha root extract twice daily for 8 weeks increased T3 and T4 hormone levels compared to a placebo. However, its effects on those with overt hypothyroidism or those taking prescription thyroid hormones are still unknown. Based on all the clinical research, ashwagandha seems to be most effective for managing anxiety, stress, and insomnia. There's also some evidence that it may help with athletic performance, menopausal symptoms, male infertility, and intimacy issues in both men and women. However, for other conditions that have been studied, the research is too weak to draw good conclusions. Keep in mind that most of these benefits have been shown in populations from India and the Middle East, not North America. In terms of safety, ashwagandha generally appears to be well tolerated. Common side effects include drowsiness and headaches, and large doses may cause gastrointestinal upset. Although rare, there have been reports linking ashwagandha to cases of liver injury. Another consideration is that ashwagandha herbal extracts tend to accumulate higher levels of heavy metals compared to other herbs. Supplements, especially generic or raw forms, may be more likely to contain high levels of these metals. To reduce this risk, I suggest you stick with standardized and purified forms of ashwagandha, particularly if you plan on using it long term. One example is the extract KSM66, which has been standardized to its withanolide content, although other standardized extracts of ashwagandha have been used in research studies as well. Overall, ashwagandha has shown significant benefits in populations in India and the Middle East, which likely explains its popularity as a traditional medicine. Although there's limited research on North American populations, the evidence supporting ashwagandha is still compelling, especially for managing anxiety, stress, and insomnia. For instance, if you struggle with insomnia due to overthinking at night, ashwagandha might help you fall asleep. If you live in North America and want to try it, I recommend using a standardized extract like KSM66. If it ends up working for you, that's fantastic. And if it doesn't, at least you'll have a better understanding of potentially why. Hi, I'm Dr. Brian Yeung. What are your experiences with ashwagandha? Let me know in the comments down below. And if you found this video helpful, please subscribe to the channel and leave me a like. Hit the notification bell if you want to stay up to date, and share this video with someone you know can use the info.